of the main problems in pregnancy is backache. I'm going to isolate the upper back and the lower back because they have slightly different techniques that we use to remedy it. So this video is going to focus on the lower back, the lumbar spine. So this is the area here. It's not the back of the pelvis. Some people mistake this area here for backache. This is your pelvis and sacroiliac pain. I'm going to focus on here, the lumbar spine, the lower part of your back. One of the main reasons that we get pain here when we're pregnant is that the weight of our growing baby starts to pull the pelvis forwards. And as that happens, the lower back starts to develop a deeper curve, and then it compresses the nerves. So the most important thing to focus on in keeping our back in alignment is our posture. The way to work with your posture, pregnancy, is to focus on the feet. So as that forward rotation happens in the pelvis with your growing baby, you'll start to notice your weight tipping forward onto the balls of your feet. So the first step in rectifying this is drawing your weight back into your heels. There's a nice little exercise you can do to practice with this. So you can come up onto your toes, you can stretch the arms up if that feels good, and then you rock back onto your heels, just let your bottom stick out a little bit as if you're skiing or about to dive into a swimming pool. And then come up again onto the toes, and then come back into your heels. And just do that a few times, and you'll start to feel the weight migrating back into your heels. So once you can feel how that's changed, see if you've got an even amount of weight distributed through the soles of your feet and through the balls of your feet. Once you've done that, you can then unlock your knees. The second issue that throws our pelvis forwards is locking our knees and pushing our thighs back. Once you do that, you tighten your hamstrings, you tighten the quads, and the pelvis tips forward again. So in order to keep your pelvis in a neutral position, just a slight unlocking of the knees. This can take time to do if you're a habitual knee locker. It took me a very long time. So once you've done that, you can then bring your fingers onto the front of your pelvis and just notice if there's an over tucking or an over tilting. Bring the pelvis back into neutral. And then the last thing you can do is give a little lift to your ribs. Relax your shoulders. And that's your perfect standing posture. So once you've sorted out your posture, you can start to work on the second aspect of looking after your back during pregnancy, which is to stretch out the lower back and to create more space between the lumbar vertebrae. So here's an easy one that you can do regularly. You're just going to dangle forwards. Start with your knees wide enough for your baby to be comfortably spaced in between your legs. Keep the knees bent and then just slowly curl forwards. And then just let go of your head, relax the back of your neck, relax your shoulders. Keep the knees bent so that your back can really lengthen. The weight of your arms and your head will start to draw the spine open a little bit more. And then you can do a little twist to one side and a little twist to the other side. And then come back. Now to come up, you're going to come really slowly, particularly if your blood pressure is low. Take your time, uncurling one vertebrae at a time and coming all the way up. Come onto all fours, spread the fingers wide and take the weight evenly into your hands and into your knees. As you breathe in, push into your hands, lift your chest. And as you breathe out, tuck your tailbone under and start to curl your spine up to the ceiling. Push your hands into the ground. Breathing in, lift the tailbone, lift the chest. And breathing out, tuck your tailbone under. Roll your spine up to the ceiling. And again, breathing in, lift the chest. And now this time we're going to go back, right the way onto our heels. So you'll need to make some space for your baby. Take your knees wide enough so that your baby can snugly fit between them. And bring your big toes together. Breathe in, lift the chest. And breathing out, tuck your tailbone under. Roll the spine to the ceiling. And ease yourself all the way back onto your heels. Make sure that you keep your back round. Don't untuck your pelvis, otherwise you won't get this really amazing stretch in your lower back. And then breathe in and come back. And again, on the exhale, tuck your tailbone under, roll the spine to the ceiling, keep it round, and come back onto your heels. So this stretch pulls open the lumbar vertebrae and it counteracts the effects of your pelvis tipping forwards and tilting forwards during your pregnancy. And breathe in. Come up. And again, on the exhale, tuck the tailbone under, roll the spine to the ceiling, keep the lower back round. So this movement opens out the vertebrae in your lower back and it counteracts the standard pregnancy posture where your pelvis tips forwards because the weight of your baby drags it forwards. And then breathe in, come up. Now tuck your toes under, lift the knees off the ground and just walk one heel at a time down towards the ground. Keep everything fluid, keep everything moving. And then bring your knees back down.
The lying twist is a really good way to stretch out any stiffness or tightness in the lower back. You need to come and lie down flat on your back. So come onto your side first, and then from that position, roll over onto the back of your body. Have your knees bent, feet on the ground, and stretch your arms out to the sides. Take a long, slow breath in. And as you breathe out, take your knees over to your right side, turn the head to the left. Take a long, slow breath in and out. And as you breathe in, come back to the center by pushing the feet into the ground and gripping the thighs together. And then exhale the knees over to the other side. Turn the head in the opposite direction. Long, slow breath in and out. And on the inhale, grip the thighs together again. Come back to the center. Just repeat the same practice about 3 times on each side. Every time you breathe out in the twist, relax a little bit more into the buttocks, into the thighs, and into the lower back. Every time you breathe in, feel the twist lengthening upwards into the middle of your back as well. After a few repetitions, you should find that your back is beginning to loosen. However, if you feel any discomfort lying on your back, if you feel breathless, nauseous, then please stop the practice and come back up to sitting. And when you've done 3 rounds, just bring the knees back to center, slowly roll over onto your side, come back to sitting.